Well, good Wednesday to everyone. I want to start today by recognizing the 50th anniversary of Earth Day, a peaceful protest of millions in 1970 that is now one of the global community's most significant annual events. No doubt this is a very different Earth Day than we're all used to, but this pandemic has put us all face to face with how essential it is to have a holistic view of international public health. Though we can't march outside together this year, I encourage all Illinoisans to take part in honoring Earth Day, which you can do at home by participating in things like virtual teach-ins and digital outreach. Especially on this Earth Day, let's be all in for Illinois. On to today's update. As you know, more widespread testing is a key goal for combating COVID-19. It's a vital feature of our long-term path to building a new normal. Along that path, we need to make testing more available and convenient to more people. So I'm pleased to announce 2 additional state-run drive-through testing sites, both of which are available to anyone who has COVID-like symptoms and wants a test, even without a doctor's order. Today in Aurora, we opened a new drive-through at the Chicago Premium Outlets Outdoor Shopping Mall, located at 1650 Premium Outlet Boulevard in Aurora. That location can take up to 600 specimens per day. And starting on Friday in Rockford, we will open a drive-through location at the University of Illinois College of Medicine, Rockford. The address there is 1601 Parkview Avenue, and that location will be able to take 500 specimens a day when fully ramped up. Between these 2 new sites and our 3 existing sites in Markham, Bloomington, and in Harwood Heights, our 5 drive-throughs can run up to 2,900 tests per day when the Rockford test site is fully up and running. Again, anyone who has COVID-19-like symptoms, even if they do not have a doctor's order, can get a test at these locations. And this is the criteria that we are encouraging testing providers all across the state to follow as well. And in honor of National Laboratory Professionals Week, that's this week, I want to take a moment to recognize the hospital and private and public lab technicians across the state, especially those that support these drive-through operations, because these tests are just swabs until a lab professional turns them into results. These folks are a vital part of solving for our testing needs. To North Shore Hospital in Evanston, Reditus Laboratories in Pekin, Edwards Elmhurst Hospital in Elmhurst-Naperville area, Star Lab Corporation in Franklin Park, and many others, know that I speak for all of Illinois when I say we are so grateful for the work that you do. I also want to provide a brief update on our ongoing efforts to source personal protective equipment. We've now sent out more than 15 million items, including 7.7 million surgical masks, nearly 1.7 million N95 masks, over 30,000 gowns, over 6.4 million gloves, and over 350,000 face shields to locations all across the state of Illinois. We also have outstanding orders due to arrive in the coming days and weeks, with an additional 25.5 million N95 and KN95 masks, 25 million surgical and general medical masks, 8.4 million gowns and coveralls, 14 million gloves, and 7.5 million face shields and goggles. Finally, I'm proud of the people at the Illinois COVID-19 Response Fund, who have worked tirelessly to raise private funds and are providing grants to organizations on the ground in our most vulnerable communities all across Illinois. The fund has raised more than $30 million from over 2,400 donors since its March 26th launch. You may recall that earlier this month, the fund distributed its first $5.5 million to 30 organizations across Illinois. Well, today, the Illinois COVID-19 Response Fund has announced funding $4.8 million more for 18 nonprofits around the state. These are organizations providing people with access to food and shelter, health care, help with their mortgage and utilities, and focusing especially on supporting children and seniors, those with disabilities, immigrants, victims of domestic violence, and others. These are organizations that are truly carrying their communities through this pandemic, and I am so very grateful for their partnership. Individuals and families who are in need of support, or those who want to contribute, should visit the same website. It's ilcovidresponsefund.org. That's ilcovidresponsefund.org. So thank you, and now I'd like to turn it over to Dr. Ngozi Ezike for today's medical update. Doctor?
Thank you, sir. Good afternoon, everyone. And again, I echo the governor's sentiments and laud all of the lab professionals across the state who are helping us with this COVID response and with all the other lab tests that still need to continue to run. We are encouraging people to get tested, as you heard the governor say. More and more locations and facilities are starting to offer testing. Federally qualified health centers, or FQHCs, the mobile testing sites the governor mentioned, hospitals, health clinics, and urgent care facilities are all offering options. Testing will help us know just how widespread the virus is and what communities are being impacted most and where we need to target our responses. We already know some of this information through the testing that we have been able to do, but more is yet needed. Additional testing also helps further spread. Many people have only mild symptoms or even no symptoms, but they can still spread the virus as we continue to learn and increase our information about this novel virus. With additional testing, people will know if they are positive and then can take the appropriate precautions, such as self-isolation, which will help reduce the spread to others, including the most vulnerable. More testing is one of the keys needed to end this pandemic. As of today, we are reporting 2,049 new cases in the state of Illinois, and unfortunately 98 individuals who have lost their lives. This brings our statewide totals to 35,018 cases and 1,565 Illinoisans who lost their fight against COVID. At the end of yesterday, we had 4,665 individuals in Illinois who were hospitalized with COVID-19. Of those, 1,220 were in the ICU, and 747 of those ICU patients were on ventilators. Please allow me to continue to encourage everyone to do their part by staying at home, by wearing masks when outside, by washing their hands frequently, cleaning frequently touched surfaces. It's the only way we're going to get through this pandemic, as mundane as that may seem. Please stay safe, please stay healthy, stay home, if not just for yourself, but for others around you. And with that, I will translate comments into Spanish. Buenos tardes. Como dijo el gobernador, estamos avisando a la gente que se hagan la prueba de COVID-19. Más lugares en el estado están comenzando a ofrecer pruebas en sus comunidades. Desde hoy, los sitios de pruebas móviles, algunos hospitales, clínicas de salud y centros de atención de urgencia serán haciendo pruebas. Las pruebas nos ayudan a saber cuáles comunidades están más afectadas y dónde necesitamos una respuesta específica. Las pruebas adicionales también ayudan a prevenir una mayor transmisión del virus. Con pruebas adicionales, las personas sabrán si son positivas y pueden tomar precauciones, como la cuarentena, lo que reducirá la transmisión a otros. Más pruebas es una de las claves necesarias para poner fin a esta pandemia. A partir de hoy, reporto 2,049 nuevos casos, incluyendo 98 personas que han perdido la vida. Nuestros totales estatales incluyen 35,018 casos y 1,565 muertes. A finales de ayer, 4,665 personas en Illinois fueron reportadas hospitalizadas con COVID-19. De ellos, 1,220 pacientes estaban en la unidad de cuidado intensivo y 747 pacientes con ventiladores. Todos deben hacer su parte. Es la única forma de superar esta pandemia. Tenemos que seguir trabajando juntos, porque solos no lo haremos. And with that, I will turn it over to Governor Pritzker for questions.
Hi, Governor Eric Hong with ABC7. Got a long list of questions from colleagues here, but wanted to begin with one of my own. The argument has been made regarding the stay-at-home order that the intention or the goal was not to eliminate COVID-19 by April 30th. That was never going to happen, but to buy time for the healthcare capacity to increase, for the ICU beds to increase, to get the ventilators and the PPE here, to get the alternate care facilities up and running, including McCormick Place. And credit to the administration, a lot of that has been accomplished in a short amount of time. So the argument has been made that because the healthcare capacity is in a much better place right now, and because of the curve and the peak maybe coming later and lower than initially projected, why not open things up after April 30th, just in a slightly more robust way than you've so far indicated?
No, I appreciate that question, and I think people need to understand actually the principal purpose of the stay-at-home order was to make sure that fewer people got sick and fewer people would die than would otherwise without a stay-at-home order. And as you're suggesting in the last part of your comments, the curve gets pushed out when you do that, pushed down, and that's good because as you're trying to build capacity, you're trying to raise the line, that you don't want to go above, right, of how many beds do you have, how many ICU beds do you have, how many ventilators do you have. You want to raise the line so that you can fit all of the patients and the needs underneath that line of capacity, let's say. And you want to continue to make sure that wave of patients doesn't go above the line. You don't necessarily need to continue to build capacity, right? We can't build out 4 more McCormick Places. But what you want to do is make sure that the number of people who get sick is kept down. And so that's really the purpose of a stay-at-home order. It was the purpose of the original, canceling of, as you may recall, canceling of, the parades and St. Patrick's Day parades, and then closing of restaurants and bars. So that's what I think people need to pay attention to now. Obviously, the better we do at this, right? The better we do at this, the more likely it is that we can start to think about, okay, what are the safe ways to begin to reopen things so that people can go back to work, people could go back to school? Are there ways to do that keep people safe? Some of the things we've suggested already, like everybody wearing a mask, are some of what's one idea among a bunch that will help us get to keeping under the capacity and making sure that few people as possible get sick.
I think most people understand the need for avoiding a resurgence of the virus. Is there a scenario in which you can open up the economy without there being some increase in cases and fatalities? Or are you going to have to make a very difficult decision in terms of balancing an increase in order to avoid creating dire harm to the economy?
Well, I think I've foreshadowed for everybody, and I think it's widely understood that the things that you need in order to open the economy are things that we don't quite yet have in place, nor does any state. Some states are reopening anyway. That's their choice. I think people might get sick. Many people might get sick as a result of that. But look, what have I said, right? Testing, tracing, treating, and PPE. And while we're working very hard on PPE and testing and spinning up a contact tracing effort that will be very large at the end, those are three things that we have to work on. We're not there yet. You know, we've talked a lot about testing. We're just not there yet. And so having said that, you can make tweaks and moves and, you know, as you move along here and as we learn more. Remember, the researchers are learning things as we go too. Nobody was saying everybody has to wear a mask at the beginning. Nobody was saying that. Now, that's pretty common understanding among the epidemiologists and others that, you know what, it makes sense if you're going to be outside and, you know, each of you wears you don't have to wear an N95 mask. You just need some face covering because it's your droplets that you don't want to convey to somebody else and you don't want them conveying it to you. So once again, all these things are going to be kind of the new normal going forward and allow us to do things to loosen things up and begin to, as you're saying, reopen the economy.
A follow-up from my colleague, Sarah Schulte, who asks along the same lines, you know, but at what point, though, does the human cost of keeping the economy closed, the health problems that arise from joblessness, et cetera, outweigh or are commensurate to the health cost of COVID-19?
Obviously, these are things that I weigh every day and I think about all the time because I understand that it's challenging for people. There's a mental health cost, you know, in addition to financial cost. For everybody. There's, you know, this is going on, it's having an effect on everybody. And so I like everybody, I want it to, you know, to be back to normal as fast as possible. I think we're all recognizing that normal is going to look a little bit different going forward until there's a vaccine, until we can literally rid the, you know, our state and our country and our planet of this scourge of COVID-19, things are going to be a little bit different. I think we're all going to have to be a lot more careful. And while we're being careful, it allows us to begin to open things up more as long as people are in fact being careful.
Should we anticipate some iteration of a stay-at-home order until there is a treatment, until there is a vaccine, because that could be a year and a half?
You know, as you saw, there were different orders that we put in place over time, right? There was you remember that, again, we said no gatherings of a certain size, and then we said no gatherings of a smaller size, because we learned more. Then we said, you know, no, you know, restaurants and bars can't be open. Then we said we have to close schools. Then we said stay at home. Those are like, you know, that's a progression of things as we were dealing with something that was seemingly going to overtake the healthcare system and going to make people sick and more people would die. And so as you realize that, you say, well, okay, well, what's the progression of things as we all have learned that wearing masks helps, that, you know, fewer people in a space, you know, gathering together helps. What have we learned from all that helps us reopen the economy? And that's where we are now, right? We're all looking at that. Now, mind you, I just want to remind everybody, we are still adding more people to our hospital beds in the state of Illinois, even now. We're adding more people to our ICU beds, the number of ICU beds that are filled with people. These are things, you know, you don't want to be on this side of the, you know, of the curve. And so we have to get past that, and I think that's what we're all aiming at, and those are the things, I told you all the things, I've been, I think, pretty transparent about the way I think about all these things, and the fact that I want very much to find the right balance, as Sarah is suggesting.
I got to move on. Chris Hush from NBC5. Can you speak to the situation? I think this is for Dr. Ezike. Can you speak to the situation happening at Lakeview Nursing and Rehabilitation Center, where the Cook County Medical Examiner has confirmed at least 8 deaths due to coronavirus?
So I am not the one on site at each of these outbreak sites, but I do know that we have a very targeted approach to all the congregate care facilities, including the long-term care facilities, where we are working very closely with the local health departments. We're trying to make sure that everybody has the adequate testing supplies to be able to do testing on site. We have made our state labs available for any of the nursing homes or congregate facilities to send the tested specimens directly to us, because we actually are the fastest game in town in terms of the turnaround. And so we know the results of those tests are critical in order to make appropriate decisions in terms of moving patients. So we have the lab support that we're offering, as well as, technical assistance in the form of our infection control preventionists, our UIC infectious disease consultants. We are on the phone with all facilities, repeatedly trying to identify specific needs on site, sometimes by telephone, to identify, again, specific needs, whether it's education, whatever support that's needed, we're trying to offer it. Again, we are seeing these issues across the state. As I talk to my fellow state health officers across the country, unfortunately, this is not uncommon. We're seeing this as we predicted because of congregate care facilities and just the setup, but we're doing all we can and hoping that we can get all of this under control, but testing is a big part of that as well.
Dana Rebick from WGN. Yesterday during the White House briefing, Dr. Birx mentioned New York, New Orleans, and specifically Chicago were doing, quote, much better. Do you agree with that assessment, and how closely is your team consulting with the federal government on modeling and determination of the peak?
We are indeed doing better, and I want to make sure everybody understands. And look at New York, right? I mean, they've seemingly flattened their curve, but it's flattened at a reasonably high level. But flat is way better than than the direction that they were going. And the same thing is true in Louisiana, and the same thing is true in Chicago. So I absolutely agree with things are better. And so that's a very good sign of how the direction that things are going. I'm sorry, the other part of the question was?
I think in essence her question is you have your own team determining modeling and determination of the peak. Is the federal government weighing in? Are you consulting with them on that?
They are not using seemingly the data from Illinois, as far as I know, and they have not offered to help with our data or with our, estimation of our curve. They, in fact, were for a long time using that public one that others were using, the IHME curve, which is inaccurate as regards Illinois. For example, they show a much lower number of hospital beds on their site than we actually have. So it's very hard to, and they don't have the data that we have for whatever reason. So I would say, that what we have and the experts we have here are what we need, I think, to get good modeling. And there are a number of institutions that have modeled Chicago, Cook County, and the state, and we are looking at those.
From the ABC7i team, VA records show that hundreds of veterans in Illinois have tested positive for COVID-19, and at least 18 have died in VA care. Have you been in touch with the U.S. Veterans Administration regarding the growing number of cases at their facilities in our state? Is there anything the state can do?
I think I'd like to turn it over to the doctor to talk about. I just want to say, though, the VA has actually been it's a side note to the question, so the main answer will come from the doctor. But I mean, they have been very helpful in offering hospital beds from the VA for COVID patients that may need to use those hospitals. Again, it's more than surge capacity; they're real hospitals, full-on hospitals with full staffing. So I just want to compliment them on having offered to us their federal facilities, which aren't normally available to non-veterans.
So, of course, to highlight what the governor said, yes, we're already in conversations with the VA. We already have the connection with several of the VA facilities to expand and use hospital beds and ICU beds, and they even said that above the initial beds that they've offered, should we need, they can expand even beyond that. In terms of veterans contacting COVID-19 and having severe consequences, there's no one that's immune from this disease. So we're seeing it in every group. So unfortunately, there's no way to prevent it in any specific demographic, any class of citizen here in Illinois. So we're seeing it in veterans, we're seeing it in homeless people, we're seeing it in nursing home residents, we're seeing it in healthcare providers, teachers. So there's no setting, there's no type of individual, there's no part of the state that has been able to have some kind of immunity to this situation.
But is there anything that the state can do at a federal facility, either to step in or to aid the efforts there?
Yeah, so we don't provide direct care in the VA facility, of course, and even when we give these non-veterans and allow them, when they have allowed us to put, our patients in the VA, I mean, that's a partnership that they're entering with us to be able to provide additional service. So we're grateful for that. We're not the ones directly treating in those facilities. They are independent, obviously, but we're happy for the collaboration, we're happy for the cooperation, and grateful that they can provide additional capacity to us.
Okay, Jim Williams, CBS 2. One of our unemployed viewers says that she's tried getting through to IDES, quote, hundreds of times without success. She finally reached out to the governor's office, and the matter was, in fact, quickly resolved. Would you recommend that other frustrated unemployed workers contact your office as a last resort?
I certainly want to make sure that everybody gets what they need from our IDES, and I will say that there's been a vast improvement. I watch the numbers. I get a report every day, and we are processing, I think 17 times the number. The last report I saw, 17 times the number in a single day that we did a single day last year. So just to give you a sense of the magnitude of the problem. And then similarly, a multiple of the calls that were being answered a year ago are now being answered now. And so we hope that people are able to use that process. And I think the vast majority of people are able to. But of course, we want people to reach out. I would ask them certainly to first try to do it online. That is really the best way to get it done. It's going to be clunky to have a lot of people involved in the process. If you can avoid that, please do.
I imagine, though, you don't want everyone calling your office specifically.
It would be, I will say that's an unusual situation where we have the ability to intervene. Remember, the biggest issue is we can't look at their private information at the governor's office, right? We can't process for them. And so, so we have limited ability to really do anything except to hand it off back to IDES and, maybe get some attention to it.
Marianne Ahern, NBC5, a question about unemployment. When will the 13-week federal unemployment extension be implemented?
Sorry, the 13-week it is implemented. The people who have the extension on their unemployment, that's implemented now. So meaning that beyond the normal 26 weeks, it will keep going for people that hit the 26-week mark.
Marissa Parra, CBS 2. Summer camp business owners and parents say that they are waiting on official word from you to make a decision about whether summer camps will proceed or not. When can they expect that decision?
Well, I'm not making decisions about summer camps, the summer camps themselves, and I know parents will make those decisions. And I feel terrible not having a perfect answer for them because, as we've seen, you have to really watch all these numbers and see which direction we're going to know, to even begin to start to project when could you, and then of course, is it possible to do social distancing in the context of a summer camp if people are staying overnight, for example, or even in a day camp, aren't they often gathering in large groups in a summer camp? So I think these are all things that we'll have to watch the numbers and see how things are going, but I think people understand what the qualifications are going forward because COVID is still out there. It's still going to infect people, and so we're still going to need social distancing even if we don't have a stay-at-home rule. You would still need social distancing. You would still need people wearing masks. You would still need, a lot of the things that might make it difficult to, for a summer camp to operate. But that doesn't mean the summer camp can't figure it out.
An extension of the stay-at-home order into June would directly impact that.
Oh well, again, that's not something that we're, that we're contemplating at the moment. I mean, we're looking at an extension, but I don't know. I can't tell you right now how long that extension should run. And again, as you've seen, we've had to extend the stay-at-home order. We put it in originally on March 21st. It went into effect, and we then had to extend it in April to April 30th because circumstances changed.
I only have three more.
Okay.
I've been a lot of emails here. Mark Maxwell from WCIA. Missouri's governor has said that he intends to reopen most of the state as soon as next week. Missouri, May 4th, he made a correction. Given that so many people in Metro East live and work in that same region, have you had any luck working with Governor Parson to convince him why that may not be a good idea?
No, although I think I've been very vocal. I think all the governors know where I stand on, what kind of a set of principles ought to be operated upon in order to think about reopening. It's why we created this Midwest Pact of states, and we reached out to Missouri. They were not interested in joining that pact, and similarly with Iowa. I can't stop, because we have no national strategy that everybody is following, that working, that works anyway for everybody. Individual governors are making their own decisions.
Amy Jacobson, WIND, a number of healthcare workers at Lurie Children's Hospital and Rush have either been furloughed or lost their jobs. When will you allow elective surgeries to resume? Governor Cuomo is allowing them starting next week.
Yeah, we're looking at that as we are in lots of other areas where, again, a reminder that when we put all these orders in place, and as, even at the beginning of April, we didn't know, how virulent this virus was going to be. How fast was it going to overtake a community, and therefore hospitalizations and so on, would rise. And so, we've learned a lot in that process. We've seen what's happened across the state of Illinois, the differences between one area and another. And so, taking that into consideration as, elective surgeries is one of the many things taken into consideration as we look forward.
You able to give us a couple more elective surgeries, just preview what you may in the coming days announce?
We've looked at an awful lot of things, and I've gotten suggestions from all across, both sides of the aisle of elected officials as well as all across industries. So we're considering a lot of different things.
And Tony Arnold, WBEZ, what is your reaction to the decision by the U.S. Department of Education that local universities can't give CARES money to undocumented and international students? Will the state provide additional aid to these students in some way?
Yeah, you know how I feel about that, so I think you know what my reaction would be. I've opened up the opportunity for people who are in our state, residents of our state, who, by the way, are taxpayers too, to be able to get some help going to college. I think that's very important, and so we'll be looking at all the ways that we can support people that are residents of our state.
Okay, John O'Connor at the AP. As you know, the House GOP outlined reopening ideas while people wear face coverings and continue social distancing that include opening businesses like department stores, salons, golf courses, and letting hospitals resume some procedures. Could you agree to something like that?
I think it's the same answer I just gave.
Shia at Politico. Mitch McConnell said today that he'd be open to letting states file for bankruptcy to deal with economic losses from coronavirus. Is that something you've considered or would consider addressing with state lawmakers?
No.
This is Whip at a local radio station here in Chicago. Back on April 5th, you said that you had not had a haircut recently and that you were starting to get a little shaggy. Have you gotten your haircut since then? And if so, who cut your hair?
Does it look any less shaggy now? No, it's for me anyway. It's I was joking that I'll end up wearing a ponytail at some point.
We're all looking forward to that. Jim Haggerty at Rock River Times. Rockford Mayor McNamara wants small retailers hard hit by big box stores to reopen with social distancing, or for you to ban big box stores from selling non-essential goods during the stay-at-home order. Are you considering his proposal?
I haven't seen that proposal. Mayor McNamara is a very thoughtful mayor. I certainly would like to look at what they, how they are configuring their suggestion. But, I've spoken with mayors all across the state about what's of concern in their communities, and I'm trying to take all of that into consideration as we make changes, not just now, but, as we move forward. Obviously, even in the president's plan for reopening, there's this contemplation of phases. And so we're going to be looking at each of these things with regard to those phases.
Greg Bishop at the Center Square, what specific metric has the multi-state group come up with to determine when to reopen? Is it a downward trend of the number of positive cases, the number of deaths, the hospitalization rates? Is that going to be regionalized?
We certainly talk about that as a group. We have shared our best ideas, and that's really the purpose of this pact. So I will look at the common interests that we have, and then look at the things that are good for Illinois that come out of that pact. But that's one of the reasons we have a pact like that, is we have lots of things in common as Midwestern states. So I know that we'll be able to, let's say, keep people safe and healthy while we're reopening things, in part because we share borders and ideas with one another.
Kelly at Block Club, a question for Dr. Ezike. Is there updated information on healthcare workers who have been sickened and died? If not, will the state make this data publicly available? We've heard from multiple reporters of nurses and doctors getting sick and dying in Chicago.
I carry in my binder some stats. I never know exactly what I'm going to be asked. I think I do have healthcare staff data. So again, I have to remind all that the data that's put into our electronic reporting systems is put in by someone else. We're not going into the hospitals to get it. So whatever is put in is what we have to share. So it may not be complete. It's what, again, it's what we have. We do have at least 2,500 cases that indicate that the occupation is healthcare worker. That is a specific designation that we try to ask for. So we have over 2,500 cases that have indicated healthcare worker. So that could be anyone that works in a healthcare establishment. So it could be a nurse practitioner, a respiratory therapist. It could be the front desk staff at a clinic. It could be a long-term care facility worker. So I can't give more specifics, but I know over 2,500 healthcare workers, and we think that we know of potentially 8 deaths that were associated with that.
Dave Dahl at WTAX. Governor, has anyone put a sharp pencil yet to how much revenue the state is missing out on with all of these closed businesses?
Well, we did talk about this in a prior press conference. So yes, our revenue department, in fact, gave us those numbers, and I provided them, and I'm happy to ask my press secretary to provide those to you again.
Dave McKinney at WBZ. If Illinois has a second wave, what is the plan to keep a steady supply of PPE? If that's a problem now, how would it get better?
Well, you talk about it as a problem. It's a problem in the sense that we're constantly working to find PPE and acquire that PPE. It is being acquired at prices that are being driven up by the competition that was fomented by the lack of organization of the market that would have come from the Defense Production Act being utilized here. It's a problem in that sense, but we have been successful. You just heard me announce some of the numbers of the PPE that we've acquired already and the items that are on order. So, I announce those because I want people to see and understand that we are acquiring PPE, and indeed we are distributing it across the state. Every county Department of Public Health gets a delivery from the Illinois Department of Public Health, and they are the ones responsible at the county levels, other than where there's a city department like there is in the city of Chicago. The county Department of Public Health is responsible for distributing PPE across its county, and occasionally where there are hospitals that are of specific need, we can step in and deliver directly to them.
Jim Leach. Governor, Representative Batnick said today that he expects restaurants would be among the last businesses to reopen. Is that also your thinking, and what would it take to reopen restaurants for dining in safely?
All I can say is that I've read a number of the reports people have put together, including one that was done by I think the AEI, the American Enterprise Institute, and a few others. The suggestion, kind of the collective suggestion, is that industries like restaurants and hospitality are harder to open than some others, which are much easier to have social distancing, for example, in a large warehouse, than it is in a restaurant where there might be booths and tables next to one another.
Rick Pearson at the Tribune has a similar question to Shia, but he asks it in a little bit of a different way. Senate GOP leader Mitch McConnell said he wants a pause in federal assistance to states and says that states should be able to file bankruptcy to discharge large pension debt. What's your thought on these two subjects?
I think that Majority Leader McConnell is certainly important to the process of getting things done in Washington, D.C., but he's not the only person involved, and there are an awful lot of senators on both sides of the aisle that disagree with him. So I'm hopeful that as a result of work that they're doing, those senators that believe that states and local governments deserve and need additional support, that their work, along with the work that I do and other governors do, and I've spoken with multiple governors about working with their delegations to make sure that they're lobbying, and getting them going to get something completed that will be of assistance to states. It is vitally important. Every state, I was on a National Governors Association call earlier today with many, many governors, and literally every governor that spoke said the same thing. We need that state and local support.
Dan Petrella is wondering, with the Republicans and their press conference today, his question is very similar to everyone else's, but wants to know about state parks as well.
About how we
If we
consider
would reopen
reopening
them.
state parks. Yes, it's something that we absolutely have considered. I've heard a lot about it from people who live in areas where the state parks have been closed. Remember that one of the biggest reasons that we closed state parks originally was the state workers who work there, who have to work in close proximity, even though you might think of a state park as being quite large, where the state workers, how they work, right, is often in a building together and in trucks in which there might be multiple people that are in the truck as they travel around the park. And so that's obviously not, at the beginning of this, that was not something that was acceptable, too close a proximity, and even now. And so we've talked a lot about how we might make changes that would allow people to use state parks.
Greg Hines at Cranes, in suing your administration today, heads of major business groups said that recent COVID-related extension for workers' comp benefits were pretty much unilaterally imposed on them without consultation or debate. Is that true?
That is not true, and I don't really want to comment any further because I know it's a subject of litigation.
Marnie Pike at the Daily Herald. The Association of Illinois Chiefs of Police is contending that felons convicted of violent crimes are being released due to COVID-19. Is that correct?
Who contended that? Sorry.
The Illinois Chiefs of Police Association. There's a second part of her
Can
question.
you just read the question?
Yes,
I
hold on one
apologize.
second. It's split into two.
Yeah.
Okay, so the Association of Illinois Chiefs of Police is contending that felons convicted of violent crimes are being released due to COVID-19. Is that correct? They cite a woman called Alma Durr.
As you know, I review applications for commutations of sentences as governor. It's what every governor does. You can look back through, I have the records of each of the governors, Republican and Democratic. So, I do commute sentences. So those are, the contention that I am, that I'm looking at and actually do commute sentences. That's an accurate depiction. I'm not sure what implication they're making there, but.
This is from Hannah at the Daily Line. Governor, you said yesterday that COVID cases in county jails aren't being monitored by the state. Why? And do you know of any outbreaks outside of Cook County Jail?
The county public health officials are responsible for monitoring those county jails all across the state, to be honest with you, and that's true also of Cook County. And it's also the purview of the county boards in those jurisdictions. So that's just, that's the way things are set up. We provide PPE, I just want to remind everybody, to the county departments of public health so that they can provide it to all across the county. It will be to first responders and healthcare workers first, as well as to nursing homes, to other healthcare institutions, and to the needs of county jail.
This is from Becky at KTVI. As you consider extending the stay-at-home order, a majority of the cases are in northern Illinois. What's your message to residents in downstate and Metro East, where there are just a fraction of the cases and deaths?
Well, we mentioned Metro East. Actually, there's a hot spot in Metro East, and so I would remind you that nowhere in Illinois are people immune from COVID-19. There are fewer cases, it's true, in some counties, but you heard me say at the beginning, when there was only one county that had cases, that this was likely to spread. We now have 96 counties with cases, and so what I would say to people who live in central and southern Illinois is I'm taking into account the fact that there are fewer cases and fewer deaths in those areas, but we're also looking at hospital availability and other factors to determine how we might think about changes that will be good for people who live in areas that don't have as virulent a spread of COVID-19.
Bruce Rushton at Illinois Times. Local health authorities have confirmed 7 cases and 1 death at a Sangamon County nursing home. The first illness was confirmed in March. The death occurred April 16th. The online IDPH tracking database shows no deaths and no cases in Sangamon County nursing homes as of April 19th. Why does the database show no cases or deaths given the 7 cases and 1 death in March?
I'm happy to turn it over. Again, it's about the data in and the data out. I'm sure that's what Dr. Ezeka will say, that we get reports from the county departments of public health about the deaths that occur. We also get them from hospitals, but the deaths that occur in those areas, and then that information is put on the website. If those are not reported to us, we can't put them on the website because we didn't know about them, or they weren't reported as COVID-19 related deaths.
This is from Eugene Daniel at WMBD in Peoria. As mentioned in the Q&A yesterday, the Fulton County Board Chairman is accusing IDOC of not allowing 5 Canton correctional officers to receive testing prior to returning to work. Yesterday, the governor said it was, quote, a labor issue. Governor, doesn't this go against what you've said in protecting people on the front lines, in this case correctional officers, and also would not allowing them time to receive test results potentially put another prison at risk?
Well, actually, the question as it was asked yesterday was a question about the 14 days. Someone was claiming that people would get off after they served in another location than the one that they normally serve in for the Department of Corrections. So I was responding to that part of the question. As to the question of whether people should get tested, 2 things to take into consideration. We absolutely want people who are on staff and frontline work, who are first responders and so on, to get tested. That is absolutely, they are the priority for us. Anybody that has COVID-19 symptoms now can get tested, but also frontline workers have the ability even to go to the drive-thrus and get tested without those symptoms. So I didn't, if I misspoke yesterday, that was why I misspoke. I was answering maybe, the first part of your question and didn't separate out the second part. Did I get all of the question?
I think so.
Can you just repeat it one more time so I make sure
Yeah, I passed it up, but I will find it. Does this go in protecting people on the front lines, in this case correctional officers, and also would not allowing them time to receive a test potentially put another person at risk?
We absolutely want people to get tested, and if they have been exposed to people with COVID-19, they should self-isolate. So we want them to do that, and we would make sure that that was possible for them.
Okay, Mark Maxwell will be our last question today, but he's got like 4 questions in one, so let me see if I could do this efficiently. Today is the highest number of positive test results reported in one day. How do you explain the surge? Is this because more FQHCs are testing, more counties are submitting essential worker tests to the state? That's the first half. Let's do the first half.
Well, the most important thing that happened today that led to a lot higher positive test count is we tested more people. I think the testing number for today was 9,300 and some, and that's the largest number yet. So that's why you see a larger positive testing result.
Yeah, Mark's question was why is that the highest number of testing?
Because we tested more people. I thought, did I
Yeah.
understand the question
Yeah,
correctly?
he
Why do we
wants
have the
to know-
highest number of positives today?
Yeah.
Because we
He
tested more
wants to know
people.
why we have the highest number of tests today.
Oh, well, I think I don't know how many days in a row I've been trying to, I've talked about this, and we certainly every day I'm working very hard to expand testing in the state. And so, you're starting to see some success. You've seen other days that were, where we were in the 7,000s and almost 8,000. This is the first day at the 9,000 level. I want many more tests in the state. So you shouldn't be surprised if that testing number gets, continues to go up.
And then,
I'm sorry, is it the automation that's really kind of kicking in and driving the numbers up?
It's a combination of things, honestly. I've said before, and I just want to make sure you understand that because all the components that are necessary it's a complex set of things that you have to make sure you have all together. And as you've heard, we've also lowered the bar a little bit on who can get tested now. Used to be you had to have a doctor's order. Now you don't need a doctor's order. So these are all, they work in conjunction. You need the swabs, you need the VTM, you need the reagent. You need to make sure that you have access to labs that have the machines, or in some cases we've acquired machines and put them places. And then you have to have the lab technicians, and again, it's National Lab Technician Week, so recognizing their efforts. So all those things have to work in conjunction with one another, and then you need more drive-through sites and places that people can go. All of that is being spun up at the same time by us in the state.
all right, this will be the last question. Were the early models predicting a peak in mid-April wrong, and do you believe the public has a right to see the models you're using to make these life-altering decisions?
So I think I made clear, but I'll repeat that I've relied upon a variety of experts. You can reach them yourselves. They're the experts at Northwestern. They're well-known. The Northwestern, U of C, U of I, UIUC rather, UIC. These are SIU, examples of folks some of whom have developed models, and so I look at all of those and listen to those experts, because I think one of the things that maybe isn't widely understood is these models they change literally every day, and the reason is because you're projecting on one day, right, about a bunch of days forward. And then as you move forward, you have actual numbers, not projected numbers, to plug into the model. And guess what? That will be different than whatever you projected by its very nature. So there's nothing exact about these models, and it's really important for people to understand that, I'm estimating, we all are. Even the modelers are estimating. And the purpose for the estimating isn't so much that we know exactly what date, some date at which you might peak. That's not the purpose of the models. The purpose of the models, from my perspective, is to understand what the capacity needs will be for us in our hospitals, among our healthcare workers, to treat people who might get COVID-19 on those dates where we might have a very high infection rate and a need for more hospital beds. So that I hope that gives a bigger picture of what we're looking at. But I think you should look at all of the online models. They're worth looking at. And then we'll be talking more about modeling tomorrow to give you a better understanding of how we look at things.
Thank you, everyone.
Thank you.